Sorry, guys. Give me just a minute here. Okay. How is everybody today? This is your last Monday in class. Can you believe it? I can't. It goes so quickly. All right. Did everybody do chapters 8 and 9 over the weekend? Does anybody have any questions for me? Anything I can help you with? No? All right. Let me go ahead and get your scores. Rochelle?
I got 90 and 85.
Okay. Thank you. Do you have 2 and 3 for me?
90. 90.
Okay. And then I need 5, 6, and 7.
It's 90 and 7 is
85. All right. Got it. Okay. Thank you. Neve? Thank you. Shakima? Thank you. James? Vanessa? Thank you. Christopher? Dwayne? Maya? Vita? Okay, thank you. Lucille? Thank you. Asia? Shelby? Adam? Thank you. And Faith? Okay. All right. One class left. That's it. Wednesday. We graduate. Today, it finalized the skills. We're going to go through the last 3 skills today. So after today, skills are over. Wednesday, we will have information on how to keep your certification after you test, after you get it. So we have to talk about renewal requirements, continuing education, all of those types of things. We're also going to talk a little bit about employment, how to find a job, because finding a job in medicine is a little bit different than finding a job in other industries. And we're going to talk about why. We'll also talk about what the best place for you to begin working in, rather than just, I think I want to work in the hospital. Do you really understand what all is involved in that and what type of environment and what makes it different from working in other settings? And why you might be better suited for the hospital or maybe better suited for somewhere else. And we're also going to craft our tell me a little bit about yourself answers. And there's actually, this is really cool. There's actually a formula that you can use to create your own tell me a little bit about yourself. And that way, when that question shows up at the interview, because it always does, you have an answer that is prepared and helps them see your value. So I'm going to show you how to do that in class on Wednesday. We'll also take a graduation photo on Wednesday. And we have a folder that I'm going to give you to get you ready for the rest of your career. So we have a lot of things to go over. It's not a formal graduation. We don't do caps and gowns and, you know, in front of family, and it's just us. But if you guys want to bring cookies or cupcakes or pizza, or, you know, if you want to make it yours, you're more than welcome to. Some classes do, some classes don't. But if you decide to do that, you guys can kind of work among yourselves and figure out what you want to do. We will have about an hour and a half of practice time at the end of class today. So I'm going to talk for about 2 hours roughly on these 3 skills that we're going to learn. None of them are hard. You already know how to do most of these. But we are going to go through what's left here. And then you'll have practice time. All right. So I'm going to pull up a chair because I'm hurting today. So I'm going to have a seat. All right. Let's see. Tomorrow is my game show. And if you haven't checked this out, this point is a great time to watch the game show because you're so close to the end. The game show, I do 15 questions that are very similar to the state exam, and we do it on YouTube. And if you join YouTube, when I put the question up, I'm going to give you 4 answers. It's a multiple choice test, 1, 2, 3, or 4, and you type your answer into the chat. Once you type that answer in, it will automatically be graded and awarded points. And then at the end, whoever's the top 3 on the leaderboard gets prizes. So I give away my CNA Principles card game. I give away badge holders and motivational gifts as well. So if you have a chance tomorrow at 11, go to my YouTube channel. It's the number 4, YOUR CNA. We're branded everywhere for your CNA. If you like and subscribe while you go onto my YouTube channel, YouTube will actually send you a notification to your phone that I'm live. So you just have to click it and we show up. It's super. They make it really, really easy. So that's for. Oh. Sorry, guys. Hold on. Okay. I forgot I don't have an assistant. I've got to have my laptop over here so I can see comments. Okay. So that will be happening on Tuesday. You also have a practice test in your skills book, your spiral book. Practice test is on page 191. This is very, very, very similar to what you're going to see on the state exam. They're not the exam questions. Nobody can give you the actual exam questions. I don't care what they promise on their website. That is test integrity. And if they are giving you the questions, that's an ethics problem because you've got to have questions that are similar, but not the exact same. So this is going to give you a really good indication of how you're going to do on the written test. If you miss 5 or less on my test, on the test on page 191, you're ready for the state exam. You're good. You won't have any problems passing it. I've never had a student that missed 5 or less on my practice test fail the written. Never. So it's a really good indicator of how you're going to do. If you miss more than 5, you need to get my ebook. The ebook is free. It's on my website. It's foryourcna.com/ebook. Let me put that in here for those of you playing along at home. Okay, so that's the ebook. And that ebook will help you understand why the questions are written in a certain way and what they're really trying to ask you when you're looking at those questions. So it really, I've had thousands of people that have gotten the ebook and have come back and told me that it really helped them pass a state exam. I had one girl that failed the written twice and got the ebook, and she didn't just pass it the last time, she made 100. So it really, going from failing twice to acing it, it really does break down those concepts and make it super easy for you to take that written test. So 5 or less on my practice test, you're good. No worries. More than 5, get my ebook. It's free, but it will help you. And of course, you can always get the ebook just to prepare if you want that little bit of extra insurance. But the game show will help you with that as well. I've been doing this for well over a year, so there's tons and tons of questions if you go back and watch the replays too. So lots of opportunities for you. CPR today. I forgot about this. CPR today at 2:00. So after class, you can go grab something to eat. When you come back, those of you who are going to be participating, when you come back into class, we'll get started on CPR somewhere around 2. It should end around roughly 5:30-ish. We're scheduled till 6. Depends on how many people I have show up. If I have a whole room, we're here till 6. If I only have 2, 3, 4 people, then we can get out just a little bit earlier than that. Okay. So, all right. So I told you that we're going to talk on Wednesday a little bit about where the best workplace for you is. I actually have a quiz that I made for you. You'll get this in your wrap-up email, the link for this. I spent 2 years developing this quiz. It was not something that I just threw together really quickly. There's a ton of psychology in this quiz. And it's not going to ask you, can you give a good bed bath? That's not the type of questions. They're all personality-based questions. And it's designed to figure out where you fit best in healthcare. And this is why. How many of you guys think you might want to work in a hospital? Yeah, it's usually about half the class. And I don't know why the hospital is a big draw, but it is. And a lot of people think that that's the best place for them. Unfortunately, the hospital is not usually the best place for a brand new CNA. In some cases, yes, but it's very fast-paced, incredibly fast-paced. There's no time to learn on the job. So you've really got to get your skills nailed down. You can't take 20 minutes to give a partial bed bath if you're going to work in a hospital. There's just not that much time. So you've really got to have your skills on lock before you ever think about working in a hospital. But the real problem here is that in a hospital, patients change all the time. So you're going to have really close communication with the nurses. Remember, we report all of our observations. Well, in long-term care, your patients are the same Monday, Tuesday, Wednesday, Thursday, Friday. I mean, they never change. And when something does change, it's pretty obvious because you know Henry. You've been working with Henry for months now. And you can pick up on it really quickly, but you're not really going to work all that closely with the nurses because there's not much to report, right? But in a hospital, your patients are changing hourly. So you're going to have that really good communication. You're going to have to be able to thrive in a team environment. You're going to have to be able to take constructive criticism. If you're the type of person that bristles the minute somebody tries to correct you, hospital's not the place for you. But you also have to think about the shifts. Are you a 12-hour shift type of person? Or do you get tired out and want to go home after 8? So you have to think about those things. You have to think about the type of care. Do you want to do more personal care, or are you intrigued more by the high-tech stuff? Machines beeping all the time, monitors and IVs and all of that. So all of these things are going to go into figuring out where the best place for you to work is. And there's 9 possible settings. So if you have a minute before Wednesday, I would take this quiz so that you kind of have an idea in your head where you might best thrive when you're right out of school. That way, when I'm talking about it, it'll make a little more sense to you. So you'll get a link for this in your email, your wrap-up email. So Donna asks, how can I get the ebook? Donna, just go to foryourcna.com/ebook. Put it in the chat for you. foryourcna.com/ebook. Just fill out the form on there and it'll be emailed directly to you. It's a PDF. You just download it. Super easy. It's a workbook style. All right. Where am I? Too many buttons. All right. So we're not going to do a review today. I've reviewed you until you're sick to your stomach, I'm sure. If you want to review, go back to last Wednesday because everything was on last Wednesday's review. But I'm not going to review with you today because by week 4, you should have it. You should understand that the care plan tells us what we need to do. Every skill has to start with the opening and end with the closing. You should know if you have supplies, you need a barrier to put them on and when to get that barrier. You should know how to evaluate if you need gloves. You should know to use a privacy blanket anytime the patient's uncovered or undressed, and you should know not to hold linens against your uniform and not let them touch the floor. You should also know how to bathe somebody. Whatever we wash, we rinse. Whatever we rinse, we dry. We check the water, so do they. You should also know that the patient needs to be in the middle of the bed at all times and how to get them there. You should know how to clean all of your basins. You should know if the feet hit the floor, we got to talk about their shoes and how to evaluate if a gate belt is snug enough. All of those things you already know. We don't need to review them. You've got them down. But if you need to review, the review sheets that I've been giving you at the end of every class have all of those principles on it. So all of those things will help you get ready for the state exam. How many of you guys feel pretty confident in your knowledge about the state exam, but you feel like you need a little practice? Okay, good, good. That's exactly where you should be right now. You should feel a little uncertain about the skills. You should feel a little anxiety about those skills because you haven't really had much practice time yet. You will today and you will on Wednesday. Make sure you're taking advantage of that. Very important. Take advantage of the practice time that's offered to you. All right, so let's go back to page 147 in your book. If you guys aren't practicing here, make sure that you get a practice kit so that you can practice somewhere. Come in here and practice. Everything's free. But if you can't, the practice kit will certainly help you. All right, so if you look at page 147, this is going to follow the same process we use for everything else. If you look at all of the principles down the side, you'll see there's nothing new to learn here. And all of those principles are spelled out in the banners on the page. So all we have to really learn is the skill-specific steps. Okay, that's all we're really learning here. Things related directly to bedpan. This is a live patient skill. If you look at the bottom of this page, you'll see it's going to be done on a live patient. And before everybody starts to freak out, let me explain how they're going to do this for the test. You're not really going to use the bedpan, although you will really sit on the bedpan. So what's going to happen here is the evaluator, if you're the patient, so let's just say that you're the patient, the evaluator is going to give you a hospital gown to put on over your clothing. You stay dressed, but the hospital gown goes on over your clothing and you lay down in bed. Whoever is going to perform the skill will put a chucks under you, the bedpan under you, give you everything you need to go, and then take the chucks and bedpan away after you say you're done. Now, nothing's going to be in the bedpan. It will be empty. But we're going to take it to the bathroom and we're going to dispose of our pretend urine, even though there's nothing in the bedpan. So it is a live patient skill in that you will be sitting on the bedpan, but you're not actively going to be using the bedpan. So let's go to the next page, page 148, and read the care plan at the top of the page. And I'm going to explain to you why the care plan says some of the things that it does. It says the resident has requested a bedpan. The resident is not wearing undergarments and is able to wipe self. The resident is able to move as directed. So let's go through this real quick. It says they're not wearing undergarments. Now, I can clearly see that you as the you guys are all wearing clothes and you're going to have a hospital gown on over your clothing. So why does this care plan say they're not wearing undergarments? Because for the test, we don't want you helping somebody out of their clothing. Okay? Because the care plan doesn't matter what your eyes tell you. The care plan says they're not wearing undergarments. That means we don't need to help them get out of their undergarments. They don't want you undressing anybody for the test. It also says they're able to wipe themselves. Again, same thing. We don't want anybody near your no-no square. So the care plan says that you can wipe yourself so that we're not trying to do that during the test. Good? Makes sense? What do we know about the care plan? Follow it. Absolutely. So that's really important here. If you are doing the test and you try to help somebody take their clothes off, the evaluator is going to say that's not on the care plan. That gives them a way to redirect you without telling you you're wrong. All they have to say is it's not on the care plan. If you try to wipe somebody, they're going to say that's not on the care plan. Make sense? Good. That's why the care plan says what it does. Now, in a clinical setting, we're probably going to be helping patients off with their undergarments. We're probably going to have to help them wipe because, not much space there. But for the test, we're not going to go there. Does that make sense? Good. It also tells us that the patient can move as directed, and that is awesome because you can ask that patient to lift their hips. And that makes it easy to slide the bedpan under. So if they lift their hips up, the bedpan just slides easy. If somebody can't lift their hips for whatever reason, then we turn them on their side, put the bedpan against their backside, and then turn them back onto that bedpan. To take it out, you hold the bedpan down and turn them off of it. Okay? But it's way easier if they can lift. Way easier. Good? Makes sense? You can see the supplies at the bottom of the page. And this skill does take 2 sets of gloves. Denture Care did too. So those 2 skills, Denture Care and Bedpan, both require 2 sets of gloves. Good? Questions? So our care plan, one more time, says the resident has requested a bedpan. The resident is not wearing undergarments and is able to wipe self. The resident is able to move as directed. So we're going to ask our patient to lift their hips for the test. That just makes it a lot easier for us. And remember, you guys can lift your hips. Now, for the exam, remember I said that the evaluators pair you up? You guys remember that? So one of the things that they're going to look at with a lot of the skills that we do is the size of the person that you're going to be doing skills on. So if you're going to be doing sideline position where they have to turn you on your side, or transferring from bed to wheelchair, or ambulate and bedpan, they're going to try to find somebody your body size or smaller. to make this a little bit easier for you. Okay, good? Makes sense? Now, that's not always possible. So we have to know how to do this on people that are larger than ourselves, because it's not always possible given the people that show up for the test on that specific day. But they do try to pair you up to make this a little bit easier for you. Okay, good. If you have just had a hip replacement and cannot lift your hips effectively, that's something you need to tell them when they check you in. When they check you in, they're going to ask you, do you have any health conditions that would keep you from being a patient for any of these skills? Well, if you can't lift your hips, you need to tell them that. I can't lift my hips up, because they're not going to use you for bedpan. Good? Makes sense? Okay. So let's talk about this. 1 second here. So let's talk about this. This is not something that a lot of people really know about or understand. And it's actually a really important part of what we do when we're working with bedpans. So let me explain. Remember that we talked about assessments, right? When a patient comes in, a nurse has to do an assessment, head to toe, real problems and potential problems. You guys remember that? Okay. So patients come with doctor's orders. So every patient that gets admitted has doctor's orders. And there's 3 things specifically that doctor has to address. Has to. Every admission comes with these 3 things. The first is a diet order. Okay, doctors decide what diet the patient needs to be on. Low sodium, low protein. Chapter 8 went into all of that, right? Low fat, calorie controlled, all of those different types of diets. So diet orders are first on the list. The second is going to be mobility. Do we want this patient in bed? Do we want them out into a chair every shift? Do we want them to walk at least once a shift? Do they need help transferring? I mean, what is their mobility? That's always done by the doctor. Okay. So eating, diet, mobility, and the third is toileting. These are all doctor's orders. So when the doctor is making this decision, he's got to look at a lot of different factors. Nurses are going to address this as well. If, as the nurse, I get the orders and I think that I have a difference of opinion, I can call the doctor and tell them I think this is a better toileting method for the patient. Okay. So this is going to be part of the nursing assessment, but the doctor is ultimately going to have to order whatever we decide. Make sense? So doctors and nurses work together. Do you guys know the difference between doctors and nurses? Do you guys know the difference? Doctors and the medical team, so there's medical and there's nursing. They work in the same place. They do not do the same things. Medical teams are designed to find out what's wrong with you and figure out how to treat you. And that's what we think of when we think about medicine. What's wrong with you? How do we treat it? Okay. So they're always focused on the problem. Well, if everybody's focused on the problem, who's paying attention to the patient? Things get missed. So that's where nursing comes in. Nursing isn't focused on the problem. Nursing is focused on the patient that's having that problem. So while the medical team is using medications and treatments and tests and all of those things, nursing is there to implement orders, but also to make sure that the patient is comfortable, that their pain is being managed, that their vital signs are being evaluated, that they're being turned every 2 hours, that somebody is cleaning them, right? Because if it was up to the medical team, none of that would happen. They're just focused on the problem. They don't care about the rest of it. They're focused on the problem. So there's a big difference between medical and nursing, really big difference in their focus. Well, remember, we're nursing assistants, so that's why we're going to focus on the patient. Got it? Pretty cool, right? So when a patient comes in, the doctor is going to go through this pathway that I'm about to take you down to decide how this patient is going to toilet, because everybody's going to have to toilet. And I am going to do my assessment, and I'm also going to go down this pathway as well. But the pathway starts with, is the patient continent? So can they hold their urine? If they're incontinent, we're just going to do peri-care every 2 hours around the clock. We talked about that last week, right? So if they're incontinent, that's easy. Peri-care every 2 hours around the clock. But if they are continent, oh boy, that opens up a whole can of worms. What we hope is that that patient can go to the bathroom anytime they want to, just like they would do if they weren't here. Just like you do. You got to pee, you go to the bathroom. Take care of it yourself. We're not involved. That's what we're hoping for. But not all patients are going to fall in that category. Maybe they need some help. If they can go to the bathroom all by themselves, we call that bathroom privileges. They just get up and go. If they need help, we're going to call that bathroom with assist. They're going to call you on the call light, say, I got to go pee. You help them there, help them with whatever they need, and then you help them back to bed. Bathroom with assist. But sometimes patients can't get all the way to the bathroom. It's just too far. In that case, we have a portable toilet we can bring right to the side of the bed and help them, or they can transfer onto the portable toilet. That's called bedside commode. Now, maybe they can do it all by themselves, or it might be bedside commode with assist, somebody to help pivot them, transfer them. If the patient can't get out of bed at all, isn't going to the bathroom, isn't using a bedside commode, now we've got some hard decisions to make. Is a catheter a good solution for this patient? You would think that that answer would be yes a lot, but actually it's not. We're going to find out why in just a few minutes. Catheters are only used if the pee can't physically come out on its own. So, or if it's going to come out at a very bad time, like during surgery. So we only use catheters in very specific situations. So all that I'm left with here, if a catheter isn't going to work, is bedpan. Now, notice that that wasn't my first option. It's actually the last option. Do you guys see that? We don't jump right to bedpan. And that's because bedpans have a ton of problems with them. I mean, a ton of problems. It is literally our last resort. I'm just going to set this here for a minute. It is literally our last resort. So let's find out why. Give you a little visual. So, do you remember us talking about feeding last time? And I told you that feeding is a hard skill to be a patient for because it's the first skill we become independent at. You guys remember that? Do you remember talking about the things that we learn when our brain is new stick really well? You guys remember that? Okay, both of those things go into this skill. And let me explain why. So if we have a patient who is laying in bed, so this is my patient, this is my bed, okay, and we put a bedpan under them, that does not mean their brain is going to let them go in that bedpan because you've been trained since you were this tall. Don't pee in the bed. Don't pee in the bed. Don't pee in the bed. And certainly don't poop in the bed. So just because we have a plastic pan under their butt does not mean their brain is going to let them go because their brain knows that they're still in a bed. Now, the other problem here is that when you're trying, as a female specifically, when you're trying to urinate in a bedpan, let me show you what a bedpan looks like. This bedpan is plastic. It has a flat surface. Okay. This is a bedpan. It has a flat surface, and it's only this far from your undercarriage, right? So when you're actually sitting in here, your undercarriage is going to sink down in. Take a look at that, right? Not much space there. When that pee comes out, it's going to hit this plastic surface and splash back. Okay. So the whole undercarriage of your patient is going to get wet. It's very uncomfortable. Does that make sense? Splashback. The other thing is that this bedpan, although, I mean, it kind of has a little bit of a wide base of support, it tends to rock, you know, especially if you have somebody with any girth on them at all. This isn't going to be all that stable. So there's a lot of problems with this thing. But body mechanics is a really big part of this. So if we have bedpans, by the way, are used for urinary and bowel elimination in women and bowel elimination in men. For urination for men, we have something called a urinal. It looks like a little milk jug. That's what they use. But when we're working with bedpans, there's a step that most people don't really think about. If this is my patient laying in bed, if I take a bedpan and put it underneath their middle, what did it do to their middle? Raised it up. How many of you ladies can pee uphill? You can't. And if you are successful, that pee is going to go right up your back and into your hair. And I don't know about you, but that's really high on my gross meter, right? So when we put a bedpan under a patient, this is not a normal elimination position. Your patient's not going to be able to go. Now, if you think that's bad, try having a bowel movement in this position. It's not going to work. So when you put a bedpan under a patient, you have to get them into a sitting position. This is the only way a bedpan will actually work. It's not going to work great, but at least it'll work. It's not going to work at all here. So the most important step of using a bedpan is actually putting the head of the bed up. Otherwise, everything else you do is worth nothing. Does that make sense? Got it? So for bedpan, the most important step is to adjust the head of the bed. Now, once you get the patient in a sitting position, they use the bedpan. You can't get it out from under them because they're sitting on it. That's not going to work. So we got to put the head of the bed back down to get this bedpan out. So with all of this head of the bed motion, whatever's in the bedpan is going to slosh. So what could we maybe put on the bed that's absorbent and waterproof to help protect the sheets? A Chucks. Yep, that's right. So we're going to start out with a Chucks. And the way that we put a Chucks on the bed is clean rolls toward me, dirty rolls away. We've done this before. We know how to do this. So we'll put a Chucks under the patient, and then we're going to get the bedpan and put it under the patient as well. Now, when you're putting a bedpan under the patient, the wide end, the part that looks like a toilet seat, goes under the butt. Imagine perching on that. Imagine your butt on that. That would be very uncomfortable. This is designed to hold the backside. Good? Make sense? Okay. You want the opening, this part, between their legs. So everything goes into the bedpan. You don't want it so far up that it's not going to catch anything. So similar to how you would sit on a toilet. Now, once the patient is done and you put the head of the bed back down and you take this bedpan out from under the patient, for the test, there's not going to be anything in it. It'll be empty. But in a real life setting, we don't carry open containers of urine through a room, because carrying an open container of urine, if you trip, you're going to go face first into it. And that's just really gross. So it's also a privacy issue. Nobody needs to see what's in here. So when we take the bedpan out, we take the Chucks with it and wrap the Chucks over the bedpan. That way, it's going to cover the contents for privacy, but it's also going to provide a cover in case of spilling. or tripping. Really gross. Okay, so when we put the bedpan, we're going to position it with the wider end underneath the buttocks toward the back. And we have to put the head of the bed up. That bedpan is sitting right where the bed bends. So when you're putting the bedpan under, don't get it too far up because it can slide all the way up and then not be where it needs to be. Okay. So this takes a little bit of practice, putting the bedpan in the right way and then putting the head of the bed up to make sure it's in the right spot. Does that make sense? Look at it when you get the head of the bed up. Ask the patient, are you comfortable? Does it need to be adjusted? You may not get it right the first time. But when we put the chucks under the patient, the bedpan under the patient doesn't have undergarments on because our care plan told us. So I've got butt juice on those gloves. Do I want to touch that bed controller with butt juice gloves? No, we want to take those gloves off and put the head of the bed up. We're going to give the patient toilet paper and a call light. And we're going to step around to the outside of the curtain and we're just going to wait. Because remember, our care plan said they could wipe themselves. So they're going to take care of everything all by themselves. So we're going to go to the other side of the curtain and we're just going to wait. Now, in a clinical setting, I'm not going to stand there because people need privacy to be able to use the toilet. So I'm not going to stand on the other side of a curtain in a clinical setting. I'm going to wash my hands and go take care of somebody else until that call light comes on. Good? Makes sense? But for the test, you have no other patients. There's nowhere for you to go. So we're just going to step around and wait and give them privacy. When they say I'm done or beep, beep, or whatever they're going to do to indicate they're done, then you're going to come back to the bedside, put the head of the bed down, put your gloves on. Okay. Then we'll remove the bedpan and the chucks, and we're going to wrap the chucks around the bedpan. Remember, it's going to be empty. There's nothing in it, but we're going to pretend like there is. We'll dump the bedpan in the toilet because that's where it normally goes. We'll rinse it and dump the rinse water in the toilet because that's where it normally goes. And then we can remove our gloves. Now, the patient wiped themselves. How do I know they wiped themselves? The care plan told me. So because they wipe themselves, they need a hand wipe to make sure that their hands are clean after. And then we can remove that privacy blanket. So this is a bedpan cleaner. And I like to point this out to you guys. If you're working in a hospital setting or a rehab setting, you'll see these. They don't have them in homes. But it looks like a little bitty shower head. If you pivot that forward, it's on a long stalk here, but it actually pivots. If you pivot it forward, it starts to spray into the toilet bowl, and it's there specifically to clean bedpan's butt. It's a great way of cleaning a bedpan because then you don't have to, good morning, then you don't have to use the sink, which is good. Now, the problem with this is you've got water under pressure hitting a flat plastic surface that now has body fluids in it. You're going to get splashback. There's no way around it. If you use a bedpan cleaner, and they are helpful, but if you use it, it means that you're going to get all kinds of stuff on your uniform. Splashback. So we're going to use a yellow isolation gown over our uniform to protect it and then throw it away after. You've already got gloves on, but you probably want to protect the holes in your face as well. So one of those masks with a face shield is what we want to use so that no particles that are put into the air because of the water are able to get into any of our doorways. Good? Makes sense? So this is helpful. You're going to dump it right in the toilet, rinse it right there, dump that right in the toilet. But you want to make sure that you're protecting all of your clothing and the holes on your face using the right personal protective equipment. So that's pretty much how we use a bedpan. This one you're going to have to practice with a little bit because getting the bedpan in the right spot isn't as easy as I make it look. Remember, I've got lots of experience, okay? So this is one that you're definitely going to want to practice. The practice kits have bedpans for those of you playing along at home. If you order the practice kit, it does have a bedpan in it. For you guys, the bedpans are always in the bottom drawer. So these drawers, the 3 drawers on the bedside, they're actually arranged in a very specific order. The top drawer is for grooming. So you're going to find hairbrushes, toothbrushes, toothpaste, that type of thing. Grooming. The middle drawer is for bathing. So basin, soap, lotion. The bottom drawer is for toileting. So the bedpan, toilet paper, graduate container, all of that. So graduate container we're going to see in just a minute. It's this triangle thing that we use to measure urine. It's hard to see on there, but you're going to see a graduate container in just a minute. So the way that these drawers are set up, top is grooming, middle is bathing, bottom is toileting. It's just like our bodies. Okay. So when you're putting the bedpan away, always put it in the bottom. We never want a toileting item above a toothbrush, just in case it drips. Pretty gross. Good? Questions on this? Questions, anyone? All right, let me show you the video for this. And then we'll get into catheter care and drainage bag.
Hello.
Hi, Mr. Jones. My name is Patty. I'm your CNA today. How are you?
Good, how are you?
Wonderful. I understand you need a bedpan. Can I assist you with that?
Sure.
I'm going to close your curtain, wash my hands, get my supplies, and I'll be right back. Okay, I'll need a Chucks and a privacy blanket for this skill. Okay, Mr. Jones, I'm going to place this privacy blanket over you. This will help keep you warm and protect your privacy as we do this skill. Is that okay?
Yes.
Okay. I'm going to spread this out without snapping it or shaking it. And I'll have you hold this in place so I can pull your sheet down. That way your sheet remains clean as we do this skill. Okay, I'm going to prepare a Chucks to place under you before we put the bedpan in place. I'm going to hold the Chucks up lengthwise and roll it toward me. Clean rolls toward me, dirty rolls away. And I'll just place this on the bed. I'm going to open the drawer that the bedpan is in and get a set of gloves. Okay, Mr. Jones, in just a moment, I'm going to ask you to bend your knees, lift your hips as high off the bed as you can, and I'm going to unroll the Chucks underneath you. Okay?
Okay.
All right, go ahead and bend your knees and lift up. Okay, and you can relax. I'm going to go around to the other side of the bed and unroll it. Okay, Mr. Jones, can you lift up again, please? I'll smooth the Chucks out, making sure it's positioned properly on the bed. You can relax. Okay, now I'll get the bedpan out from in the drawer. And I'm going to place this under your bottom, if I can get you to lift and relax. Is that comfortable?
Yes.
Okay, I'm going to put the head of the bed up, but let me remove my gloves first.
Okay.
Okay, I'm going to put the head of the bed up. Please tell me when you're comfortable.
Okay.
And you may have to adjust that bedpan a little bit as it moves. Tell me when you're comfortable.
That's good.
Okay, here's your toilet paper
and your call light. And I'm just going to wait out here. Please let me know when you're done. Okay, Mr. Jones, I understand you're finished. Let me help you with that. I'm going to put the head of the bed down now. And please do not lift your hips. Once the head of the bed is in the lowered position, I'll put on a pair of gloves. And I'm going to hold that bedpan flat as you lift off of it. Okay, Mr. Jones, I'm going to take a corner of the chucks and hold the bedpan flat as you lift off of it. You can go ahead and lift on the count of 3. 1, 2, 3. Thank you. I'll remove both the bedpan and the chucks and take them to the bathroom for disposal. I'll be right back. Once I get over here to the bathroom, I'm going to unwrap the bedpan and we'll throw the chucks away. I'm going to empty the contents of the bedpan into the toilet, and then I'll rinse the bedpan. We'll deposit the rinsed water into the toilet as well. And then we'll set the bedpan down to dry. I'll pick it up with a paper towel. I'm going to dry the inside. We'll throw that paper towel away. I'll dry the outside, throw that paper towel away, and get one for the drawer. Okay, I'm going to place the bedpan in the drawer along with the toilet paper. And we'll use the paper towel to close the drawer. Now I can remove my gloves. Mr. Jones, would you like to wipe your hands? Thank you. Okay, you can relax your legs if you'd like. And I'm going to pull your sheet up and remove the privacy blanket. Want to make sure that we roll the blanket in a ball so that any trailing edges don't contaminate other surfaces. There you go. Here's your call light. I'm going to go put this in dirty linen. I'll be right back. Okay, Mr. Jones, are you comfortable? Is there anything else I can get for you while I'm here? A magazine, perhaps? Your call light is there. Please let me know if there's anything that we can do. I'm going to open your curtain and go wash my hands.
Thank you.
After washing my hands, I'll review the steps of my skill, make any corrections, and then tell the evaluator my skill is done.
Okay. Any questions on bedpan? Are you starting to see that all the skills kind of flow the same way? The only thing that changes are a few things in the middle. That makes it easier when you're testing, because all you got to do really is think about the stuff in the middle. The opening and the closing should be just standard for you. You should be able to say them without even thinking about it. Does that make sense? Okay. And then we can just concentrate on the few steps in the middle that are specific to that particular skill. And that makes performing the skills a lot easier for the test. So let's go on to catheter care. This is on page 158. So today is all about toileting, bedpans and catheters and drainage bags. Oh my. Okay, so we are going to talk about catheters, what they are, what they do, how they work, and what our responsibilities are as CNAs. A lot of CNAs aren't familiar with catheters. I mean, you know about it as a concept, but you don't really understand how they work. So we're going to go into that too, because I want to take the fear out of it. If you're afraid of something, you probably won't really go near it because you're afraid of it. So I want to take the fear out of it. Catheters are actually very, very simple devices. They're nothing more than a flexible straw. That's it. So if you look at page 158, you'll see that almost every single principle is used in this skill. It is just like Care with an extra step. So everything we did with Care, we're going to do again, except on the back side. We don't have to do anything with the back side. But Care itself, we're going to do again, and we're going to add in an extra step. This is going to be done on a mannequin. And our care plan is going to be located at the top of page 159. So if you look at the care plan, it says provide catheter care with soap and water to a female resident with an indwelling urinary catheter. Clean the catheter tubing and perineal area only. That's it. All we're going to do is clean the tubing and the peri area. So to review with Care, we changed the chucks out because remember they were on a wet chucks. We cleaned the peri area using the leaves. Hi, thank you. No, you are. Thank you. You are a lifesaver. All right, thank you. Okay, so we're going to clean down the peri area. Remember, it's always top to bottom, and then fold your leaf. We'll clean the back side, and then we change the chucks again. This was Care. Now, what makes Catheter Care just a little bit different is that we're going to put a chucks in place, but there won't actually be one there to start with. We're just going to use the chucks to keep the sheets dry while we clean. And we're going to take it out at the end. We're not going to leave them on a chucks. You don't want to have a chucks on the bed unless we need it. Chucks are plastic lined. They're going to hold in body heat. That makes patients sweat. Now we've got warm, dark, moist, where bacteria are. So we don't want to use chucks unless we need to. So we'll use it while we're cleaning, but then we're going to take it out. We also don't have to clean the backside because our care plan said catheter tubing and peri area only. And they're not laying in urine because the tube is there to direct the urine out of the body. So we don't have to do the backside. So for this, it really is as simple as cleaning the tube and cleaning the peri area, doing your opening and closing, and that's it. So it's actually a very easy skill. I think this one's easier than Care, honestly. It's a little bit quicker too. So once a shift, if your patient has a catheter, we're going to clean the catheter tubing and the area around the tubing. This is done once a shift. CNAs also are responsible for inspecting the bag and the tubing to make sure that the bag isn't touching the floor and the tubing isn't pulled tight. So that's a part of what we do as well. So let me explain to you how catheters work. So if you're looking at this, there's 10 actual parts to a catheter system. And I want to go through each one individually. So number one, way up here is the tip of the catheter. And it actually has a hole in it. So let me pass this around so you guys can see as we go through. So way up here, you'll actually see the hole. Okay. This is just nothing more than a flexible tube. It's kind of like a straw. The end is closed just to make it easier to put in. That's all. So but the inside is just like a straw, no different than my straw over there, just a little smaller. And the end is closed to make it easier to put in. But it has a hole here. So when this goes into the bladder, the urine falls through the holes into the tubing and then out of the body. So you guys can take a look at that. So the tip of the catheter has holes to allow the urine to drain through the tubing. It also has a balloon, and we're going to talk about that balloon in just a second. The catheter itself, this is called the catheter tubing. And then down here, it terminates in 2 ports. And you can see that as it's being passed around. One port is going to connect to a collection device, like a bag. The other port is how we inflate and deflate that balloon. Now, this is a drainage bag. So a catheter by itself isn't really going to help you. All it's going to do is let the urine go everywhere. Now, if you remember when we talked on Wednesday, how often do kidneys filter blood? You guys remember? How often do kidneys filter blood and produce urine? Constantly, 24 hours a day. Drip, drip, drip. So if we have a catheter in place, the straw is just going to let that urine drip, drip, drip out of the body. So we have to have a way of controlling all of those drips, collecting them. And that's what a bag is going to do. So the bag is going to connect to your catheter. It's got tubing that the urine will go through. It's going to go into the bag. On the bag are some markings, and it's got an emptying port and a little house for the emptying port. So this is an entire system. It is what we call a closed system. Bacteria can't get in there unless we let bacteria in. That's important because that's the biggest thing that we have to eliminate as CNAs is the intrusion of bacteria. We can't let bacteria in here at all. So everything that we're going to learn to do is going to be done with infection control in mind. So the catheter and the bag are two separate pieces. And the reason for that, the reason the catheter and the bag are two separate pieces is because the catheter can stay in up to 30 days, but the bag is going to be changed out about once a week. So we have to have two separate pieces there. So in this situation, I've got, my bag and I have my catheter, and they literally just plug into one another. Just like that. Now I've got a closed system. Now CNAs can be trained to change the bags. You can be trained to learn how to unplug and replug. But when we do this, you have to use a very specific technique because we don't want bacteria to get into this tubing. If we touch this with soiled hands or soiled gloves and we allow bacteria inside, there is nothing to keep that bacteria out of the bladder. It actually has a secret tunnel that our white blood cells are not in to be able to invade. And along the way, they're going to multiply and multiply and multiply and multiply. So by the time the bacteria jump out of these little holes into the bladder, there are several trillion of them. And your patient can go from, I'm feeling fine, to, I am really sick in like 30 minutes because it's an overwhelming infection. Make sense? Be like all of China invading, like that. It would be overwhelming. Something that we wouldn't really be able to fight off real well just because of the numbers. Does that make sense? Good. Okay. So two separate pieces. CNAs do not change the catheter, but you can be trained in the future to change the bag. As of right now, you're not trained to change either. Just keep them clean. So the drainage bag is usually changed more frequently, about once a week. So what are we responsible for? Well, cleaning the catheter and the bag around, or the skin around the catheter, and making sure the bag isn't pulled tight and isn't touching the floor. So that's what we're going to be focusing on. So our biggest concern here is infection control. We don't want bacteria into the system at all. And that's because urine is the ideal environment for pathogens. It's not just warm, dark, and moist. It also has enzymes and proteins that those bacteria need to procreate, to split themselves in half. So if you remember here, if you remember looking at this, these are two kidneys. They filter blood 24 hours a day, produce urine. Urine drip, drip, drips down into the bladder. A little valve keeps the urine in the bladder until you go to the bathroom. You should remember this from last week. So all we're doing when we have a catheter, all we're doing here is holding that valve open with the tubing and directing the urine. So as the nurse, I would put the catheter in. The balloon is deflated. The catheter goes in through the urethra. Remember, this tube is already there. We're not drilling a new hole. We would advance the catheter up into the bladder. And when I get it in the bladder, I know because urine is coming out of these holes through my bag. And then I would inflate the balloon. And now that balloon just sits right on top of that valve and keeps the catheter in place. That balloon is nothing more than a doorstop, and you can't feel it. Look at that balloon in relation to that bladder. You can't feel it. Now, what you will feel is this tubing inside the urethra. It's got to fit snug. If it doesn't fit snug, see how I have gaps here? That's going to let urine leak around the catheter. That means my catheter is too small. There are different sizes of catheters. If we have leakage, it means that it's not snug enough. We need it to take up that whole space. Well, you normally don't have anything in there taking up that space. So that pressure tends to be irritating, but not painful. Make sense? It also keeps your bladder small. Bladder isn't going to blow up with urine. It's going to keep it small because urine's always coming out. Well, when the bladder is small, it means the tip of this catheter here is going to hit the top of the bladder. And the bladder has two different types of sensors, pain and pressure. That's it. So basically, the bladder can only talk to the brain with two words. P, pain. That's it. So this doesn't really feel like pain. So what do you think the bladder is going to think when it feels the tip of this catheter at the top of the bladder? Only has two words, P and pain isn't it. Yeah, so when your patient has a catheter, they're going to feel like they need to pee. That's normal, perfectly normal. They don't need to do anything. They don't have to bear down. It's just the catheter hitting the top of the bladder. It's fine. And it will go away. That sensation goes away in about 10 to 12 hours. So if they can distract themselves, they'll feel better in a little while. Good. Now, pain is different. In some people, a very small percentage, but some people, this bladder sees the catheter as a foreign object and it spasms, which is a Charlie horse of the bladder. It spasms to push that catheter out. Now, that's very painful. If your patient is saying it hurts, it hurts, it hurts, you need to let the nurse know. Good? Make sense? Hurting, that's important. That is a now problem. I have to pee with a catheter. You're still going to let the nurse know because we report all observations, but that's not an emergency. That's actually pretty normal. Good? Make sense? Okay. All right. So we're going to attach that catheter to some sort of a collection device, a bag to hold the urine. Now, there's a couple different bags. This is a bedside bag. It holds a lot. That is a leg bag. It holds a little. But if somebody is out in public, they don't want to be carrying a suitcase full of urine around. It tends to generate stares. So they would go for something a little more discreet, a leg bag. This can be Velcroed to the inside of the leg, either at the thigh or the calf level, hidden under clothing. So you have people out there walking around with catheters and you have no idea they have a catheter in because they're concealed. This isn't good for all day use though, because unfortunately it's going to fill up quickly. So if the patient is in bed, we usually use a bedside drainage bag because it holds a lot. We only have to empty it once a shift. If they're out in the community, then we use a leg bag for convenience and discretion. Good? So the name of the game here is infection control. We do not want any pathogens in the system at all, because if the pathogens get in there, there's no white blood cells to kill them, which means they're just going to eat and procreate and climb. Eat, procreate, and climb. Eat, procreate, and climb. Well, this is a problem for us because we have to empty the urine out of that port. So if we let bacteria into that system, there's no way of stopping the UTI that's going to happen. There's no way of stopping it. So when we're doing this, we've got to be super, super careful not to let that port touch anything. Nothing at all. Not your hand, not the cup, not the bed, nothing. We've got to be really, really careful here. There's only 3 places that bacteria can get into the system. This, when a nurse puts it in, if she contaminates it. This, where the catheter and the bag separate to be changed out. And then this one, which is the one we deal with, that's the emptying port. So we've got to make sure that we get this right. Bedside bags should be hanging on a non-moving part of the bed and above the level of the floor. Remember, we don't want it touching the floor. There's got to be enough slack that the patient can roll over without pulling it out. Never, ever, ever raise the bag above the patient's hips. That will cause urine to go right back up into the bladder. And any bacteria that are in the place, in the tubing at all, will they'll be just washed right into the bladder. So we don't, urine is bad enough one-way trip, you don't want it recycled. So never raise the bag above the level of hips. I always get a kick out of this. I watch some medical shows occasionally on like TLC and those. And it's funny because you'll see somebody walking a patient down a hallway and they'll be holding the bag like this. Or they'll have it hanging on an IV pole. That's just letting all of that urine run right back into your patient. It should always be lower than the hips. Really shouldn't be above knee level. Okay. All right. Sometimes patients tug at their catheters. It feels uncomfortable. It's something that shouldn't be there. And especially if your patient is confused or medicated, they'll pull it out. If a patient pulls out a catheter, we have to make sure that we save it. Put the whole catheter bag, the whole thing together in a trash bag, an empty trash bag, which there's always empty bags in the bottom of a trash can. Get a clean, empty trash bag, put the whole thing in it. Because as a nurse, I have to figure out what kind of a problem I have here. If I have a catheter that came out, but the balloon is intact, the whole thing came out, that's good. That's okay. I can deal with that as a nurse. But if I take a look at it and the balloon looks like this, that's a big problem because now I don't know if a little piece of that balloon was left inside the patient. And we can't have that because that can cause an infection and it can also cause an immune reaction as well. So I'm going to pass these 2 around so you can see the difference. You can actually see, it's not the right one. You can actually see on this one, the actual hole where the catheter burst. So you can look at the hole there. Go ahead and pass that one around. So if you see a patient tugging at a catheter, let the nurse know. If a catheter comes out, you want to save the whole bag catheter together, put it in the patient's bathroom, and let the nurse know right away. Don't delay on this because anytime a balloon comes out, it's going to cause injury, tissue tearing. You're going to see a little blood, little urine. It's going to hurt the patient. It's not deadly. They'll recover. They'll be fine, but it will hurt. But anytime we have injury, you always have swelling. And if we have swelling and I'm trying to get another catheter in, that can prevent me from being able to insert another catheter. So I've only got about 45 minutes to work with here. That's it. To make my decision. Do I want to put another catheter in or not? So don't delay. If you notice the patient pulled out the catheter, you need to let the nurse know right away. Okay? But believe it or not, patients don't pull out as many catheters as we do. CNAs pull out way more catheters than patients do. And part of that is because of what we do. Now, if that tubing is coiled near the floor, it's really easy for our feet to get tangled up in it and pull the catheter out. If we're transferring a patient from bed to wheelchair or into a chair, if that catheter bag is on the other side of the bed, you'll pull it out. Ambulating a patient, if the catheter, if the bag is on the chair and you start walking the patient, you'll pull it out. Turning a patient over in bed, if you trap that tubing between your leg and the mattress, you'll pull it out when you turn them over. There's a lot of ways that we as CNAs pull catheters out. So when we're doing mobility skills, when we're turning patients, we should always be looking for catheters and bags and make sure that everything is arranged so that the catheter tubing and the bag will roll with the patient. Good? Does that make sense? Please don't hide this. This is becoming an ethics problem, and I don't know why, but I'm getting a lot of feedback and reports that catheters are getting pulled out and CNAs aren't saying anything to the nurses. They're just letting the next shift find it. Well, imagine the effect that has on the patient, right? They have a catheter for a reason. If the pee can't come out on its own and the catheter's been pulled out, the patient isn't going to be able to eliminate. That's a serious issue. If the patient can eliminate, imagine they're peeing through that torn tissue. How is that going to feel? So this has real world patient consequences. Don't ignore it, hide it, and leave it for the next shift to find. Okay? Good? Okay. So CNA should always be aware when a patient has a catheter so it doesn't accidentally get pulled out during our skills. And it would go in a bag, notify the nurse right away, and let the nurse take a look at it. Now, there's a couple of different types of catheters that I want to talk about. So what you just saw is called an indwelling urinary catheter. That balloon being inflated keeps it in place for up to 30 days. Okay, indwelling catheter. But we don't always need an indwelling catheter. If we just need to empty the bladder quickly once, we don't need to keep the catheter in. We would use something called a Red Robinson or straight catheter. And that's what this is. There's no balloon on the end. Do you see how this is different? Okay, there's no balloon on the end. So it's not designed to stay in place. It's literally just put in, the urine is emptied from the bladder, and it's taken out. Okay, so this is called a straight cath. It's also called a Red Robinson, kind of self-explanatory. And it's used for temporary bladder relief. This is an indwelling or most commonly Foley catheter. Robinson was the guy that created this. Foley was a guy that created this. So Foley catheter is what you're going to hear for this. Good? Questions? Okay. Then we have another type of catheter, and this is only used for men. This is called a Texas catheter. It's also called an external catheter, and it's called a condom catheter because it's applied very similar to how you apply a condom. Just move that over a little. The inside is sticky, so it adheres to the skin. It has a little reservoir here and a tip that's going to connect to our drainage bag, just like the catheter. So this tip that the bag plugs into is just like this tip that the bag would plug into. Now, these are nice because they're external. That means they're not going directly to the bladder. It's not going to result in a UTI if bacteria get in there like this would. So it's a little bit safer from an infection control standpoint. The problem is that adult urine is acidic. This is a reservoir here, which means that urine will kind of stay there, and it'll be directed out through the tubing as well, but you'll always have a little puddle that stays there against the skin, and that can eat away at the skin if we're not really careful. So you want to minimize the gap between the tip and the port. You want to try to minimize that when you're putting this on. just so you don't get that urine right up against the tip of the penis with this particular setup. We take these off every 3 days. We clean thoroughly and probably put a skin protectant on to minimize the acid erosion effect. So these are good for men that we're concerned about infection control issues or infection issues using an indwelling catheter. All right, so when we're doing catheter care, we're going to hold the catheter up out of the way and we're going to clean the peri area. And then we're going to, remember, you want to hold that catheter where it exits the body so that we're not pulling on it. So we're going to clean the peri area the same way we did for peri care, exactly the same. Whatever we wash, we rinse. And then we're going to clean the catheter. So I'm just going to hold it in place and wipe down the tubing. So where this enters the body, right there, I would take my washcloth and wipe down the tubing. We're going to do that 4 times with 4 different leaves. Whatever we wash, we rinse. Good. So let's walk through this really quickly. So we're going to start with our opening. Knock, knock, knock. Hi, Miss Jones. My name is Patty. I'm your CNA today. How are you? I'm here to do catheter care. Is that okay? Close curtain, wash hands, get my barrier, get my supplies. I'm going to put, I'm going to get my water. I'll use paper towel to turn the faucet on. I'll check the water. It should be warm, not hot, not cold, just warm. I'm going to ask my patient to check it as well. I'm going to put a privacy blanket on the patient because they're going to be uncovered and undressed. So I need a privacy blanket for this. And I'm going to prepare the patient the same way I did for peri-care. I'll roll that gown inside the blanket and put a towel over the legs to minimize exposure. I'm going to put some gloves on because we're washing around body fluids. First thing your gloves should touch is the patient, so be careful about when you put them on. We're going to scoot our patient, roll them over to the side, and put a chucks underneath them. Remember, chucks, clean rolls toward me, dirty rolls away. And then I'm going to roll that blanket up and put a towel over the legs to minimize exposure and put the catheter over the towel. I'll wring out my washcloth, apply some soap to 5 leaves, and then we're going to wash while holding that catheter up and out of the way. Once down the middle, outside, outside, skin fold, skin fold. Whatever we wash, we rinse. Whatever we rinse, we dry. And then I'm going to get another washcloth, wring it out, apply soap to 4 leaves this time. Holding the catheter, we're going to wash away from the body using 4 strokes. Whatever we wash, we rinse. Whatever we rinse, we dry. Then I'll cover her back up, turn her on her side, take that chucks out from under her, get rid of all of my supplies while I still have gloves on. After I've stored all of my dirty supplies where they go and my clean supplies after they've been cleaned, I'll take my gloves off, take the privacy blanket off and pull the sheet back up and do my closing. Thank you very much, Miss Jones. Is there anything else I can get for you while I'm here? Are you comfortable? Bed is in the low position. Would you like a magazine before I go? Here's your call light. If you need anything at all, let me know. Environment is clean. Open the curtain. Wash my hands. That's the whole skill. Okay. All right, so let me show you the video for this one. And then we'll get into drainage bag. Drainage bag only takes me about 15 minutes to talk to you about. And that's emptying the bag. Remember, that is 100% infection control.
Jones, my name is Patty. I'm your CNA today. How are you? Good. I need to do catheter care. Is that okay? I'm going to close your curtain, wash my hands, get my supplies, and I'll be right back. Okay, Miss Jones, I'm going to gather my supplies. I'll start out with a barrier that provides a clean place to put my supplies. And we're going to get 4 washcloths, a towel, a chucks, a privacy blanket, and now I'll gather my basin and soap. And a set of gloves. All right, Miss Jones, I'll just get some water. I'll be right back. Okay, would you like to check the water temperature and make sure it's okay? It's good? Good. I'll place the washcloths in there to stay warm. And I'm going to cover you with a privacy blanket. This is going to help protect your privacy and keep you warm while we do this skill. And I'm going to pull your sheet down to about your knees. Okay, Ms. Jones, I'm going to place this pad underneath you. This is going to help keep your bed dry while we do this skill. First, I'll roll it toward me. And place it on the bed. And then I'll put my gloves on. All right, Ms. Jones, can you scoot toward me, please? Thank you. And can you roll onto your left side? 1, 2, 3. Thank you. I'm going to be very careful, making sure that the catheter tubing rolls with the patient and doesn't get pulled on. I'm going to unroll the chucks underneath the patient's hip and have the patient come back onto their back, making sure that they don't lay on that catheter tubing. Ms. Jones, can you scoot to the middle of the bed, please? Thank you. Ms. Jones, can you scoot toward me? Thank you. And roll up onto your right side. 1, 2, 3. And now I can unroll the chucks to protect the bed. Come on back, Ms. Jones, and scoot to the middle of the bed. Thank you very much. Okay, now I'm going to start cleaning the catheter. I'm going to roll your gown up inside the blanket. I will be exposing you, but we'll make this as brief as possible. Please let me know if you're uncomfortable. As I roll the gown in the blanket, I want to make sure that I don't grab the catheter, that we don't cause any unnecessary pulling or stress on that catheter. And now we'll cover her thighs with a towel. This exposes only the area that we're working on. I'm going to take the first washcloth and wring it out and apply soap to 4 leaves. 1, 2, 3, 4. Now I'm going to clean your catheter. I'm going to hold the catheter where it exits the body, wrap the washcloth around, and wipe away from the body. Fold that leaf over. I'm going to hold it, wrap the washcloth around, and wipe away from the body. That's 2. We're going to do this 2 more times. Away from the body. 3. And the last one. 4. I'll set this washcloth aside. Whenever we wash, we must rinse. So I'll wring this washcloth out, and we'll use it to rinse that catheter the same way we washed. I'm going to hold it where it exits the body, wrap the washcloth around, and wipe away from the body. We'll do this 4 times. 2, 3, and 4. Set this aside. Now we'll dry the catheter. Now we're going to do peri-care. We'll take a washcloth out of the basin, wring it out really well, and we're going to soap 5 corners. 1, 2, 3, 4, and the back side is 5. Okay, now I'm going to clean the peri area. I'm going to lift the catheter up out of the way with my pinky and hold the labia open while I clean down the center with the first leaf, always going top to bottom. And then we'll remove the washcloth and fold that leaf over. Now I'm going to clean down one side of the labia, top to bottom, fold that leaf over, clean down the other side of the labia, top to bottom, fold that leaf over. I'm going to clean the skin fold between the groin and the leg, fold that leaf over, and clean the other skin fold between the groin and the leg, and then set that washcloth aside. I'm going to take the final washcloth and wring it out really well, and we're going to rinse all of those areas the same way that we washed them. So I'll hold that catheter out of the way and spread the labia open, cleaning down the center, top to bottom. Fold that leaf over, clean down one side of the labia, fold that leaf over, rinse down the other side of the labia, fold that leaf over. We're going to rinse the skin fold, fold that leaf over, and the other skin fold. Set that aside. Now we'll dry gently by patting dry top to bottom and then removing the towel. Ms. Jones, I'm going to cover you back up. I'll unroll that blanket, which will replace the gown over the patient. I'm going to make sure that the catheter and the tubing is coiled on the bed, not near the floor and not where the patient is laying on it, making sure it's not kinked. Ms. Jones, I'll be right back. I need to dispose of your supplies. The towels and washcloth will be placed in dirty linen. The basin is going to be cleaned the way we clean everything else. We'll return the basin to the drawer, and on the way we'll pick up the soap. We'll open the drawer with the paper towel and return the basin to its storage area. Now I'll dispose of my paper towels. Okay, Ms. Jones, I need to remove the chucks from under you. Can I get you to scoot toward me, please? Thank you. And can I get you to roll up on your left side? 1, 2, 3. Thank you. I'll roll this soiled chucks toward the patient and tuck it under her hip. Come on back, Ms. Jones. And scoot back to the middle, making sure the patient is not laying on that catheter tubing. Okay, Ms. Jones, can you scoot toward me again, please? Thank you. And roll up on your right side. And I'm going to remove that chucks from the bed. Okay, you can scoot back to the middle. Thank you. This is going to be thrown away. Okay, Ms. Jones, let me just look at your catheter one last time. Make sure that the catheter tubing is coiled on the bed, that the catheter is not on the floor. Everything looks good. I'm going to remove the chucks from the table, and we're going to throw this away, and then I'll remove my gloves. We'll throw those away. Okay, Ms. Jones, I'll pull your sheet up now. And I'll remove the blanket as I do so, rolling it into a ball. You put this in dirty linen. Okay, Ms. Jones, here's your call light. If you should need anything, just let me know. Are you comfortable? Can I get you anything while I'm here, like a magazine? I'm just going to open your curtain and wash my hands. After washing my hands, I'll think about the steps of my skill, make any corrections that need to be made, and then tell the evaluator my skill is done.
Okay. Any questions on that? All right, so we're down to the very last skill that we're going to learn, and this is drainage bag. This is on page 164. So as you can see, no new principles to learn. We've already mastered everything that we need to know to do this skill. All of the principles are detailed down here for you. This is a mannequin skill. Somebody with your level of experience should be able to do this skill within 9 minutes. They give you way more time than you need. For this one especially, it only takes me 3 to 4 minutes to do this. So giving you 9 is way more than you actually need. This is a measuring skill, which means that we're going to have to document for this skill. Remember, in the closing, it tells us we have to wash our hands before we document, and then what do we do after we document? Wash them again. So page 165, at the top of the page has our care plan. And the care plan tells us to empty the resident's urinary drainage bag into a graduate container. This is a graduate container. It's actually called a triangular graduate container. Graduated just means it has markings on it, measurement markings on it. But these have ounces and it has cc's. Which one do we use in healthcare? cc's, yeah. Remember with feeding, we had to learn how to convert ounces to cc's by multiplying by 30. Well, this actually, we don't have to convert it. We're just going to use the cc side for measurement. So we're going to empty the urine into this, and we're going to measure it on a barrier, on a flat surface, at eye level, and we're going to round to the nearest number, the nearest mark. These are all marked in 50s. So you'll see here there's a mark for 200 and there's a mark for 250. The little mark in between would be 225. So let me pass this around. You can take a look at that. So this skill is pretty easy. All we're going to do is empty the urine out of the bag into the container. We're going to measure the urine, and then we're going to empty the container and clean it and store it and do our closing. There's really not much here, but you have to understand infection control. We do not want that emptying port to touch anything. Because remember, if any bacteria get into that urine, it's almost virtually certain that the patient will get a UTI from it. So not letting that port touch anything really is the most important part of this particular skill. So we went over this last skill. There's 2 different types of bags. There's a bedside bag and a leg bag. Both of them have drainage ports. They're a little bit different. This is called a T-valve. Your drainage port is going to come out of its house, be straightened out. The T-valve will be pushed to the side to empty, and then it has to be closed when we put it back in its house. Notice when I'm opening and closing, I'm not touching this end of the port. We never want to touch this end of the port because that's how bacteria would get in. So I'm always keeping my fingers on this section, not near the end. So we slide and slide. Good. And then we put it back in its house without touching a lot of the bag. So we don't want to do this. Should slide right in its port. Now, leg bag's a little different. This is a twist valve. And when somebody's wearing a leg bag, they can go into the bathroom. They can position their leg over the toilet. They can twist the valve, and the urine will empty into the toilet. So you don't always need a second container when you have a leg bag in place. So when emptying the drainage bag, we're going to put our barrier on the floor. And then the graduate container goes on the barrier. Remember, we never want it directly on the floor. So we'll put the barrier on the floor. We'll put the graduate container in place, and we'll empty the bag into the container. When we do that, remember that port can't touch anything. So to open a T-valve, you just slide it to the side. So this is our bag. We would slide that to the side. And once we're done emptying it, you want to make sure that it's closed. So you can tell by, when you look through it, it's closed. Now it's open. So you can see the difference. Go ahead and take a look at that. So the graduate container needs to be measured on a barrier, which we have on the floor. We're going to wrap the barrier around our container to take it to the bathroom, just like we did the bedpan. And we're going to measure this on the lid of the toilet. So we're going to set it down on a barrier, on a flat surface, and we have to get down at eye level to measure this. So if you look at this line here, I don't know if you guys can see it, but there's a line there. And that is right around the 450 mark. We're going to measure to the nearest line. If it were closer, more up here, we would call it 475, nearest line. Doesn't matter whether it's up or down, just nearest line. And when we document, we not only have to put the time, and military time is best. If you don't use military time, if you use regular time, you have to put AM or PM. You have to. Military time is best. I have a lesson in the book on military time if you don't know how to do military time. You have to write the type of output. Urine is not the only thing that can come out of the human body. We can have blood and wound drainage and emesis, which is vomit, and diarrhea and urine. I mean, there's all kinds of stuff that can come out of the human body. Urine is not the only thing. So we have to indicate what kind of output we're measuring. We are going to put how many cc's and our initials. And you have a copy of the documentation sheet in your skills book as well. So we're going to follow our care plan. I'm going to walk you through the skills step by step here real quick before I show you the video. We're going to follow the care plan. Every skill starts with an opening. Knock, knock, knock. Hi, Ms. Jones. My name is Patty. I'm your CNA today. I'm here to empty your drainage bag. Is that okay? Close curtain, wash hands, get supplies. We're going to put a barrier on the floor. We're going to put our graduate container on the barrier and get our gloves on. Once we're wearing our gloves, we're going to empty the bag into the port, or I'm sorry, into the container using the port, not letting that port touch anything. And then we'll close that valve. Always make sure it's closed before you store it. Once it's in the house without touching anything, then we can gather up our container with our chucks, take it to the bathroom, set it on the lid, and we're going to get down and measure it at eye level. So on a barrier, on a flat surface, at eye level. If you hold that urine cup up to measure it, you will fail this skill. First of all, you should never have urine that close to your face. Don't ever lift it up. But it's got to be flat in order to get an accurate measurement. Then we'll empty the contents into the toilet. We're going to rinse our container, empty the rinse into the toilet, and then store it like we store everything else. Then we can remove our gloves, do our closing, document, and wash our hands one final time. After we've documented and washed our hands, I want you to think about the skill and make any corrections. Now, I kind of speed through that. You hear that in the videos all the time. Think about your skill, make any corrections, and then tell the evaluator, my skill is done. But I really want you to think about your skill, right? Think about the steps of it. What did I miss? What deficiencies may I possibly have created so that you can correct them? You can go from failing the test to passing the test in just a couple of words. Okay, so make sure that you're taking the time to go through that. All right, so let me show you this skill. Let me show you this skill. This is literally a 3-minute video.
Hello, Miss Jones. My name is Patty. I'm your CNA today. How are you? Great. I need to empty your urinary drainage bag. Is that okay? Okay, I'm going to close your curtain, wash my hands, get my supplies, and I'll be right back. For this skill, I'll need a barrier, which I'll place on the floor under the drainage bag. I'm going to need a set of gloves. And I'm going to need a triangular graduate container. I want to inspect the catheter tubing to make sure that it's coiled on the bed and the patient isn't lying on it and it's not kinked, but also that it's not hanging near the floor where somebody might get their feet tangled up in it and trip or accidentally rip the catheter out. This catheter looks like it's in the appropriate position. We'll now remove the port from its protective sleeve on the bag. Sliding the valve to the side will open the port. We can now position this open port over the graduated container and tilt the bag slightly to the side to allow the contents to drain into the graduated container. While doing so, we want to be careful not to allow that port to touch any other surface. Once the urine bag has been emptied, we'll slide the port back to the side to close it and very carefully insert it back into its protective sleeve. We want to make sure that the bag is hanging on a non-movable part of the bed and it's not touching the floor. We can now fold the chucks over the graduate container for safe and secure transport to the patient's bathroom. Once we're at the patient's bathroom, we're going to set the graduate container down on a barrier on a flat surface and position it so that we can read it. We need to be at eye level, and we're going to round to the nearest line, either up or down. You can see that the urine in this container is nearest to the mark of 425, so the amount that we will document is 425 milliliters, or cc's. Once we've measured it on a barrier on a flat surface at eye level, we can now empty the urinary graduate container. We'll throw the barrier away, open up the toilet, and we're going to dump the contents of the graduate container into the toilet. Now we're going to rinse the graduate container. We'll deposit the rinse water into the toilet as well. Now we can clean. After dumping the rinse water into the toilet, we'll set it down, use a paper towel to pick it up, paper towel to dry the outside, a paper towel to dry the inside, and we'll discard this, and then one for the drawer. We're going to place the graduate container in the bottom drawer and close the drawer with a paper towel. Okay, now I'll throw the paper towels away and remove my gloves. We'll throw those away as well. Thank you very much, Miss Jones. Is there anything else I can get for you while I'm here? A magazine, perhaps? You have your call light there. If you should need anything at all, please feel free to let me know. I'm going to open your curtain, wash my hands, and document my skill. Thank you. After washing my hands, I'll document on the intake and output sheet that the evaluator gives me. I'm going to document the time of output, the type of output, which is urine, the amount of output in cc's, and my initials. After documenting, I'll review the steps of my skill, make any corrections, and then tell the evaluator my skill is done.
All right. Any questions on what we've gone over? You are now officially done with all the skills. Yay. They weren't too bad, right? Okay. So you have chapter 10 to do between now and Wednesday. So you're going to read chapter 10 in your yellow book. And you're going to take the test on page 190 in your white book. And remember, 191 starts the practice test. So you guys can also try that out and just see how you do. I don't accept the scores for that. That's all for you, basically. Please remember to bring your yellow book back to class on Wednesday. I will collect all of the yellow books. You won't get your graduation folder if I don't get the book back. I'm told something hostage. So make sure you bring your yellow book back. Remember, CPR is today at 2. So if you need CPR, this is probably the best time to get it because you're going to save $10. Plus, you get a coupon for 50% off of scrubs as well. So if you need scrubs for an interview or something like that, that will help you out as well. All right, so you're going to keep your study guide, but you're going to return the yellow book on Wednesday. And remember, we also take a class photo on Wednesday as well. So if you don't want to be in the photo, just don't line up when I tell you to. It's not candid. I take everybody outside. But I like to give you a heads up, for those of you who need a heads up. All right, I'm going to give you your review sheet for today. And no, we don't need an extra slide. Give you the review sheet for today. You can take a break. And then when you get back from break, the rest of the class is practice. That's it. That's all I have to teach you. You'll also have practice time on Wednesday as well. Remember that you have this room available to you until 4 o'clock. My battery just died. Until 4 o'clock. So you can always come in and practice even after graduation. So you can come in and practice even after graduation. Keep that in mind as you're going through your plans to practice for the state exam. Let me go ahead and pass out your review sheets. In the meantime, we're going to say goodbye to everybody online. Thank you so much for joining us. Tune in on Wednesday. We'll be going over renewal, some interview tips, how to answer that question. Tell me a little bit about yourself. We have a lot of things to go over on Wednesday, so make sure you tune in. But then I have 2 weeks off. Tomorrow is the game show, so tune in for that. My next class will not start again until June 10th. I actually have a couple weeks off to get some things done. All right, so until next time, guys, happy caregiving. Bye. Oh, hold on. I have a question. Let's answer the question real quick. It says, for bedpan, even if I stay in the room behind the curtain waiting on the call light, should I wash my hands after removing the gloves and before going back to remove the bedpan? For the test, you can. There's nothing wrong with it. I mean, you got to wait for the patient to get done with the bedpan anyway. So for the test, you can, but it's not required. You don't have to because it's the same patient, same cooties, same environment. You're not leaving the environment. So you don't have to. But if you want to kill time, that's fine too. But it's not required. All right. That solves all of our questions. So until next time, happy caregiving. Bye.